Okay, now it's time for us to get into health. And I know that you enjoyed that song from Moses Bliss and Chandler Moore. That's like the icon of music from Nigeria and America, locking horns. Very soon I'll be joining them so that to be Ghana, Nigeria, and America. Yeah. All right. So today is Ask the Doctor. Let's use this opportunity to say a big thank you to the Bank Hospital for supporting the morning show. And you know, with the Bank Hospital, they're at Cantonment. You should just get there. They're opposite NAFTI. Get there and get your health checked out. They have lots of clinics, stroke clinic, urology clinic, spine clinic, all of the clinics. So they keep you educated as to what's happening to your body, and then they give you the best health care that you need. Alrighty, and the phone lines are open. We're also live on Facebook and YouTube. You can like, share, and drop comments. Call in and let's have a good conversation. Okay? All right, and we have Dr. Effiong in the house. Dr. Effiong in black. Good morning.
Good morning. PBL in black. You always copy me every day.
No, you're the one who's copying me.
That's fine.
At least I show on air before you leave your house.
Who says I try to watch and see what you're wearing?
Well, yeah, I hope you're good though.
Very well.
But I'm not going to ask you about the things that's happening in, the health space, but it's okay. I know that you're not very happy about it. Are you happy about it?
No, I'm not.
You're not happy?
Happy
Who would you speak for, the minister or the doctor?
I'm not very happy about it at all.
At all, right?
Yeah.
Well, we hope that we get a good response for all of these things, because at the end of the day, it's the patients that actually suffers for all these. Well, Tuesday, we had a convo about testicular cancer. And there are a bit of, myths about it. First off, somebody says testicular cancer only affects older men. True?
So I think I can understand why the person would think that way, because when you hear cancer, you think of it affecting people who are elderly, right? But I think I highlighted on Tuesday that it's one of the few cancers that affects even younger people, as young as 15 years, up to about 35 years, right? With the peak incidence at 33 years old. So, yeah, it's actually a myth because it affects younger people as well. So the earlier you catch it, the better.
I wanted to actually, check Koku's testicular. Why are you so cracked up? I mean, I'm a friend. I should be able to help with these. These are stuff that they can't do for themselves, can they? Right? But it's better if the perspective is from a woman. I have nothing
someone commented on my social after the Tuesday session that, Doc, whenever he holds it, I think it's just moving like this. He said it's not allowing him to
test the thing. You see, so I would have to do that. I'm going to be doing that for Coco. I'll give you feedback. Don't worry. But also, somebody says that a lump in the testicle is always a sign of cancer. Is that true? Actually, take me through how the testicle should look like, because I remember you said the last time that there could be something. I mean, if you're scanning or scouting for something, it means that there has to be a regular feel.
Yeah.
Right. So from the image that you put up, it means that you're looking for something that is out of the normal.
Exactly.
But what should the normal actually look or feel like, so that when we're feeling something outside, it will be able to tell?
Yeah. Great. So it's just like, if you've ever had a stethoscope on, right? And maybe perhaps before you do, you ask someone, how does this heart sound like? We'll be able to describe it, but then again, it's something that is better experienced. Do you understand? So you better experience it than being told about it, right? So that's why we always say examine the two testes, right? So one would definitely be fine. Right, and then you'd feel the consistency of the testes. Right, now when you feel and you go around, you'd expect the same consistency or the same oval shape.
Okay.
I mentioned the shape is oval in shape. The same oval shape testes on the other side. But if you notice that there's perhaps some bulge somewhere that is not making it as smooth, it should be smooth and oval in shape.
Right.
Right. If there is something else projecting out of it, then that could be a warning sign. And then again, I think the question was every mass is a cancer.
It's a sign of cancer.
So that's not true. That's not true because you could have a cyst. A cyst could be a mass that is filled with fluid, right? And for most of the cysts, they tend to be asymptomatic, so you don't do anything about it, right? For some of them, if it's causing troubles, you have to go to the hospital and it will be drained for you, right? So it could be a cyst, but not a cancer. But I always say that if you feel something, you get to the urologist and get a checkup.
Can
just
a
to
cyst
ensure
result into a cancerous situation?
Not necessarily.
Okay.
But if you have the genetic predisposition to having cancer, like I mentioned the last time, if you perhaps have a parent or a father who had cancer, testicular cancer, or a brother, who had testicular cancer, you are perhaps at risk, to developing. So in that case, you are, on top of the game of if you see this, you want to get it checked before, but not routinely that cysts, or varicocele, but it's fluid within the sac would result to a cancer. Not necessarily, not all the time.
Okay. So I have a question here. It should be about testicular cancer. But this one has to do with breast, right? Somebody says that she normally feels that one of her breasts seems a lot harder than the other. Could that be, a reason to go to the hospital, check it out?
Is this a female asking?
Yes, a female.
A female asking. Oh, I see. Because females don't have testes, so I was wondering.
No, it's breast.
Right. So if one breast feels harder than the other, I think it's something you should get checked. Because breast cancer as well. I'm sure we'll talk about breast cancer.
Yes.
Breast cancer as well. There's a feeling of a mass or a lump in the breast, and most of the time, in describing this lump, you realize that it's firm to hard in consistency. Right, and then you also have some skin changes. There's something we call peau d'orange. It's like the breast looks like the back of an orange.
Oh.
Yeah, peau d'orange. I think it's a French word.
Okay.
Right. So if that could also give a feeling of hardness. When you touch, you see how the consists of an orange. When you touch it, it feels like an orange. So if that perhaps is what she's describing, then she should present to the facility to get it checked because the breast is supposed to be the same in consistency. The tissue of the breast is supposed to be the same. If you feel that one is harder, and she described hard, and then that's a red flag. So she should get it checked. Perhaps depending on her age, get an ultrasound or a mammogram. That would determine and tell us, okay, after examination, of course, we'd know, okay, if there's nothing wrong, or perhaps this is what you look out for, right? Yeah. But talking about breast, in men as well, with testicular cancer, right, they could have breast tenderness, some could have breast, not all the time, but some could have breast tenderness, and it could be as a result of the release of the hormone I mentioned. So there are certain hormones that go up, when the testis, is involved as well. So they could have, tenderness in the breast. So that could also, I just wanted to tie that in just to ensure that the men are not missing out on.
So with the tenderness in the breast, like you described, is it somewhat painful?
Yes, pain. Pains, like some pain. Actually, that's what I mean by tenderness. Sorry about that. So pain.
Yeah.
So
pain.
pain.
For us.
Yeah, pain in the breast. So pain is what the patient experiences.
Right.
Tenderness is what we elicit. So
Right.
if I have to examine you and I touch it and you react to it, so that means it's tender. But pain is what you'd complain about. That, oh, doc, I have pain in my left breast or my right breast. And most often it's both at the same time.
Oh, okay.
When it comes to, because it's hormonal, right? So it affects both at the same time.
Well, I've been wanting to ask this because a few times, you're having a breast cancer conversation, and somebody actually mentioned that the creams that we use, ladies lately, we want to, we want our skin to be skinning. We use all kinds of chemicals, and there's the glutathione and all of the crazy. Now we're taking pills to look. The expression is look fine from inside out. You get it, and then we take all the supplements to make us look a certain way. Does that contribute anything to breast cancer? You know?
So when it comes to topical agents, like a cream, right? It depends. What is the content? You know, some of them have strong hormones that when you use them, they tend to sink deep down to your skin, right? And also some of them are in a sense where they can cause cancer, but in this case, the cancer I'll be worried about is rather a skin cancer.
Right.
You know, because I mean, there's also skin cancer. Especially if maybe you've had a history of cancer before, or your parents had cancer, and perhaps you're exposed to sunlight, a lot of sunlight. You know, these are the risk factors. Or you have a lesion, on your skin that is bleeding, like a wound, sort of, that is bleeding. There's an ulcer and all that. So yes, most of those things, exposure to sunlight and all that, and then use of topical agents that you don't know the content, because it could be a mixture of things that we don't know until we know what it is, right? So I'll be more worried about the skin cancer, than the breast cancer.
Not even the breast.
Yeah,
yet.
skin cancer, because it's, so the surface, the skin is the largest organ in the body.
Right.
So yeah, the skin cancer. So for taking in supplements, it depends on what you are taking, really. So that's, we always advise women, if you're taking it, let it be approved by the physician. Right, some people tend to go to the gym. The last time we spoke about, we were talking about back pain.
Yeah.
When you saw that your friend used maybe this protein shake, so you want to use the same thing. Now, forgetting that if you tend to use these shakes without actually exercising, it causes what we call rhabdomyolysis. That's a breakdown of your muscles.
Oh.
So yeah, it causes breakdown of muscles. So it will be detrimental to you because you don't have the full advice to make an informed decision that if you are taking it, this is what you expect, A, B, C, D, E. If you're taking it and you don't do A, B, expect C, D.
Right.
The person might not give you that full detail. He will just tell you, oh, I take it, and he'll give you the positive. This is what happens. Fails to give you the negative. And that's what we do in the hospital, right? We give you the two sides of the coin, tell you what to expect in case maybe, because most medications with the side effect is nausea, vomiting. So we'll tell you that expect this.
Right.
So that when you start taking it and you have it, it's not far-fetched. Then we can tell you the adverse effect. If you have A, B, C, please come back or please stop the medication. So you are in the lookout as compared to someone just prescribing something for you that he or she has used and then it's detrimental to the body.
Not paying attention to their medicals and
exactly. You don't know the conditions they have already.
Right.
You don't know. It's like someone who has an ulcer, a stomach ulcer, and you're giving the person ibuprofen. There are instances where you can give that, but you have to give a gastric cover, like something to cover the line, to protect the stomach.
Right.
If you have no option at all, but ideally you want to choose a different medication for that. So you need to open up the boxes in your brains, in your mind, and let it fill together. So, yeah.
I see.
Yeah.
I think that we should have a conversation about skin cancer one of these days. I know a few people who've suffered these things. We still, probably we've towered down on skin bleaching and all of that. Now we call it toning. We're toning our skin.
A demure way of putting it.
Exactly, like dyeing, but not. I mean, by the time you close one eye and close the other, it's not like we are dead. Yeah, but I mean, there are things that I wish that we would, put out. But the fact that we're actually in Africa and our melanin is needed.
Yeah.
You get it. Even for our weather condition, some people still don't get that.
Yeah.
They just want to be fair at all costs.
Yeah.
We get it that, I mean, maybe you get more money when, when you're fed.
Really?
Oh, please.
Really?
Yes, Doc, you know what I'm talking about. Anyway.
I'm looking for that money. Please show them to me.
Right?
Let me go.
Yeah, you get more money when you're fed. They feel like, okay, they see all the blush when you're fed. But there are discussions that we should be having about that because your skin is very, very important. So back to question about testicular cancer. It says it's always fatal. Is that true?
So it's not always fatal. I mean, of course, I mentioned the percentage the last time. 95% of the time, if it's caught early, something can be done about it, right? And then you'll be treated for that, just like catching cervical cancer early in time, right? So it's always not fatal. And I think that's the fear people have, that the fear of the unknown, right? Yes, if I go and they will give me, they don't want doctors to give them diagnosis, so they prefer to stay home, which is not the right thing to do. You know, like let's get it checked earlier so that we can, you know, deal with it before.
Like normal cancers, mostly you hear somebody say, okay, this is stage 1, stage 2, stage 4 cancer, and all of that. Do you put testicular cancer in such
I mean,
ranges?
most cancers, in fact, I dare to say all cancers are staged. If you remember on Tuesday, I mentioned that depending on the stage, that informs the management.
Them. Okay, right. Great. So we have Adobia on the line. Good morning, Adobia.
Good morning.
I hope you're good.
I'm good.
Great. The doctor can hear you.
Okay, so I wanted to know how often we should use antibiotics, because usually my mom, whenever I fall sick, she just gives me antibiotics. So I want to know.
Oh, whenever you fall sick, like what kind of sickness?
Maybe if I'm feeling headaches, I have a little infection or something like that.
Then she'll give you an antibiotic. Do you remember any name?
We have amoxicillin. Often it's amoxicillin.
All right, great. Okay. Well, I can imagine that because my mom also used to give everything. Even if you have mosquito bites, you take paracetamol to start the process. You understand? Like, Mom, my head is aching. Have you taken para? It's first aid for most people. And some grandmothers will say, go and buy me Biko. You know, they don't want to ever miss out on these very important little things. So that I can understand Adobia. But is that a good thing to do?
It's not a good thing to do. I mean, the fact that she's picked it up, it means her intuition is the Holy Spirit within her. You know, that's why you have to be sensitive to the times and seasons.
Preach.
The Holy Spirit within her says, nah, there's something wrong somewhere. Call and ask. You know, so I think that it's not right. Antibiotic is something that we have to talk about well, especially as Africans, because we often misuse, you know, antibiotics. There's an indication for antibiotic. We have to show proof that, you know, there's a bacterial infection. Antibiotics are for bacterial infection, not for fungal infections, not for viral infections. Do you understand? So you have to show evidence that this is a bacterial infection before you can administer an antibiotic. Right?
Wow.
Even most kids come to the consulting room, you know, with common cold, so flu symptoms, you know, sneezing, runny nose, and all that. And you do the investigations, and there is no sign of a bacterial infection. It's classically a viral infection and would not need antibiotic. Right. Now, most patients will be surprised that you come and you tell them, oh, okay, take vitamin C, you know, if the temperature is out, take P-mol, and then there's no antibiotics, you know.
So probably there's maybe some education or some you know misconception on the street that antibiotics is like the killer.
Exactly.
It just
exactly, and I think people need to take that off their mind.
Right.
If you binge take an antibiotic when it's not needed, now the time that you would need it, your body would have developed some sort of resistance and would not work.
Right.
You see, so it's like someone who is always screaming, help me, help me, help me, help me. And then you come and it says, April Fool. You know, the day that person will need help and it says, help me, you would die.
I know, right?
You know, that's so I think it's not right. I think that it has to be indicated for before you use antibiotics.
Should we have different antibiotics for different conditions or?
There are different antibiotics for different conditions.
So it's not because it's from different companies, but same. Because mostly when you go to the pharmacy, this is what they tell you. Oh, okay, you don't have this. We have this. It's the same ingredients. That's from a different company.
Okay, I get where you're coming
and
from.
we don't even take the time to check how many ml this is.
Yeah.
Is that good for me? You know, because we don't even care to know the ingredients.
Yeah. So that's why it should be prescribed by a professional.
Right.
Because, there are certain conditions. Antibiotics are in classes. You know, they are in a class of their own. They have a class of their own, and they have functions. So you have to understand the mechanism of action of a particular antibiotic to determine would it be nice to kill this particular bacteria. Do you understand? So you can't use an antibiotic that is used to treat something else for something else. Do you get it? And also there are antibiotics we call broad spectrum.
Okay.
You know, that sort of like cover, you know, gram-negative, basically most of the bugs that affects the body, right? And most of the time we use it empirically in a sense where maybe we want to culture your blood or your urine or to find out exactly the particular bug that is causing this infection. So let's start with the broad spectrum.
Okay.
Something that can kill all the bugs, you know. And then if the culture comes back and it points us to E. coli is causing it, now we can streamline to the particular antibiotics. So antibiotics is something that we review, you know, every 48 hours.
I see.
Yeah, every 48 hours you've got to review your antibiotics, right? So it's not something that we can just, you know, just put you just like that.
But those reviews, aren't they done with people on admission? Because when you leave, they give you an antibiotic, say take one morning, one evening, or take one a day for 7 days.
So in those
you don't
cases,
go back for review.
In those cases, they've identified perhaps the infection they are treating.
Okay.
And then you go through the course.
Okay.
You know, but if it's going through the veins, we have to review them in the sense that we have to check, is it actually reducing the bacterial load or not? If it's not reducing it, then what's the point? It's not working. It's perhaps that organism or that bug is resistant to it. So you want to switch it up to something else, right?
I see.
So, yeah, and then you mentioned something about you don't know the meals to take and all that. Especially with kids, you know, you've got to know because you could have 2 5-year-olds the same condition, but the dosage will be different because it's based on the weight of the kid.
Right. Okay. So there's a caller, Yara from Kaswa. Good morning, Yara. Yara.
Good morning.
Good morning. Good morning. Let's hear you.
Okay. My question is, I don't know. I usually have this thing, frequent urination.
Okay.
Yeah. So I visited the pharmacy. I had a discharge also and an itch. So I visited the pharmacy and they gave me antibiotics. A lady called talking about antibiotics, so I was a bit scared about it. So I wanted to confirm if it is okay for me to take the antibiotics. I took it, but I still have the same reaction again, which is the itching.
Okay. So, but you said frequent urination, is that it?
Frequent urination, yes. I can urinate in a night like 20 times before daybreak.
The frequency, is it only at night or even during the day?
During the day, have as well.
I see. I wish I could ask you a lot of questions. I mean, if you were pregnant, we'd be asking questions in that line. But let me leave that for the doctor. So, Doc.
Yes, I think you're gradually building your history-taking skills, and I'm proud of you.
Thank you very much, Doc.
Right.
Yeah.
It all goes down to history.
Okay.
You know, taking a good history. Because we're on air, we don't have that time, you know, taking a good history, you know, and all that. So, I mean, when you hear frequent urination, like a light bulb moment, so many things is now springing through your mind. You know, are we dealing with diabetes? Are we dealing with a urinary tract infection? Are we dealing with an STI? You know, just thinking about it just like that.
She also spoke about a discharge.
A discharge, yeah.
Right. I didn't ask what color is it. If it's itchy,
you're doing well. I should give you an MBCHB.
You see, and I'll be on the tour with some people to some hospitals. Well, yeah. So I mean, she mentioned that there was a discharge. So can we link that? But she also said that she went to a pharmacy and she was given an antibiotic. Right? So she's only calling actually because of the previous call.
Yeah.
So she now wants to know, is that a good call or do we still have to go back to the hospital, you know, to get that right? That's what she's really bothered about.
Okay, so I mean, when a patient presents with frequent urination, now there are a few things we want to ask.
Okay.
Do you feel pain when you urinate?
Okay.
Do you feel a burning sensation when you urinate? Right. When you urinate, do you feel like there's a change in smell or color of your urine? Right. Now, do you have a discharge? What is the color of the discharge? You know, is it offensive? Because there's a particular smell for a particular disease.
And only doctors know that?
That's why we take good histories. right? And then there's a particular, condition for a particular color of discharge, So it's like you see, the eye sees what the mind knows, right? So based off on this, then we could tell that we think we are dealing with a urinary tract infection, or we think we are dealing with a sexually transmitted infection.
Right.
So we'll take a bit of history about your sexual experience, and it's a bit more private conversation, asking them, do you have a stable partner, right? How many partners do you have? Do you have, sex with condom, protected sex with condom or not? So we want to ascertain, are we dealing with an STI or a urinary tract infection, right? And then we'll do our examinations to elicit tenderness or pain, and then we'll do our investigations, send this to the lab. Let's see, what is the white cell count? So there's a process to everything, right? I'll get back to her question. I'm sure she's waiting to say what is the result of all this.
So after doing all this,
so what?
What at the end of the day?
So therefore,
Yes.
right. So after doing all this, then we can tell that, okay, let's start with this particular antibiotic. Right. Like I mentioned, there's what we call an empiric antibiotic, right? Something we can start with broad spectrum and then do a urine culture to isolate the specific bug that is perhaps causing that urinary tract infection, which is giving you the symptoms you're experiencing. Now, when we start with that broad spectrum and then review, so what was a review date? Come in 1 week and let's see, so perhaps if she's put on a particular antibiotic, she'll be reviewed in a week time. And if she comes back and her repeat labs are better, then that antibiotic worked. Now, there is no point switching to anything else. Do you understand? So, so we have to understand that there are rudiments to these things. You don't just wake up and take it. Do you understand? So I'm assuming that before giving her that medication, the pharmacist would have asked these questions. Right. So not all pharmacists are actually very trained before. Most of them are just dispensers. Dispense. If they hear pain, then this is what you should give. If you hear urinary tract, this is what you should give, right? So, but most of them that I know are actually, well trained in, asking questions, finding out. And when they think that this is beyond them, they'll tell you, we are sorry, we cannot give you this medication. You've got to go to the hospital. Do you get it?
I see.
Yeah. So that's it.
Okay. So my darling, let's get to the hospital, shall we? Because we don't want to give you, any diagnosis that might not be there. For all you know, it's actually nothing. When I was in SHS, some of the girls would have all this discharge and all these things because they switched environment. A lot of things happen. I mean, you're using a public washroom now. It's not what you were using in your house.
I mean, for her, it could be an infection.
Right.
And she wants to find out if she's even having a fever as well. It could be an infection, which might actually demand an antibiotic. But I'm just saying that the rudiments in selecting what antibiotic should be done first before administering.
Yeah, and to actually come up and ask about it, then it means that probably she feels like, maybe I'm not doing something right. So let's get to the hospital. Bank Hospital, I would advise. I mean, I would recommend that you should get there. Let's do a thorough check, see what's wrong with you. Because, some of these things are internal. If it's something that's out there, you can press and put one hot ointment on it, you would be fine. But these things we can't see. So it's better, examined. And we have another caller, Anita. Hi, Anita. Let me be waffleizing. Hi, Anita. Good morning, Anita. Hi. Oh, no.
Because you did what you did.
I know. Like, this happens later. But please call back. And if you haven't called yet or you feel like, okay, your network is not too good, get on our socials and then drop your questions. That we'll be sure to read them. Okay? Yeah. So, Anita, try it again. I've called you Anita now, so you should try it again. Well, somebody also says, if I don't have a family history, I'm not at risk. Actually, with this family history thing, I'm thinking that people here in Africa, we don't have, first off, men don't talk. They're going through stuff, they're not going to talk about it. Okay. they don't even want to talk about the fact that they don't even have money to start with. You understand? Men don't understand why they have to go to the hospital to do a few things. Last time you said that they go to the hospital
For 2 reasons.
for just 2 reasons, right? How would you even know that your uncle had testicular cancer? He might be thinking that he can't even talk to you about it. How would you even know the history? These are not things that people would have discussions about. There are certain families who, I mean, the Western world, you can have, I'm dying. Doctor says this. In Africa, you will die alone. Because whatever the doctor tells you doesn't matter to us. We just want money for transportation, uncle. You get what I mean? So how would you be able to tell the history of these things and tell that, okay, probably it's in the family? It's not like diabetics that
you
some of the things are very, very, seen and known, right? This is testicular cancer, very hidden.
Intimate.
Exactly. Thank you very much for that word. How do we know that, there's a family history, and then now we can start to be cautious of these things, right?
Yeah. So now, talking about Africans. Right? Africa, sometimes it is difficult, to have this conversation in African, a typical African.
Yes.
Because even when your parents want to tell you they love you, they tell you when you're going to school, look left, look right. Don't take something from somebody.
I know.
Ensure nobody calls you. That's their way of telling you, I love you.
Right.
Come on, just say I love you for crying out loud,
Hey, we don't say this. It's very expensive for us.
So yeah, it could be difficult.
Right.
And that's why as you grow, you become more enlightened. You tend to go to them asking them these questions, right? If they are alive, And most of the time, we'll always ask about family history. Is there any medical condition in your family history? You're right. And then they'll be like, oh, they don't really know. Then you ask, are the parents alive? It's, oh, yes or no. Oh, I'm so sorry about that. What caused the death? Because they might not really find a link, but your questioning would make them remember. There were actually once where he was complaining of pain, down in his testes. He didn't really tell me what it was, you see. So just based off of that, you can just maybe use that as the only information you have, to assume, right? But so most of the time, you'd want to ask your parents if they are alive. Perhaps ask your mother. She would know better about your father.
You're the woman.
Right.
We always know. We always know.
So you always want to find out, and it's not very distant relatives per se. It's the close relatives, right?
So would you advise that families start to have such conversations? We're building, parenting is changing now, and we're growing, things are changing, we're becoming very westernized, even here in Africa. Are these some conversations you would encourage families to have, and how would you encourage them to go about it?
So I think that it's important we start having certain difficult conversations,
right?
Especially even if you're trying to get married, you want to find out this family I'm going into, what's the history of medical conditions they have. The same way you find out about your genotype, you also want to find out, because it runs in the family, and especially for conditions that people often overlook, i.e. mental health, right? And there's a popular saying that mental health needs more candor, more sunlight, and more unashamed conversations.
And I'm unashamed right now. Okay, I'll take you. We have a very beautiful caller all the way from Tamale, right? Okay. Good morning.
Good morning.
Can you please remind me of your name again?
Nana Kunedu.
Nana Kunedu. Nice name. Anyway, the doctor is listening.
Okay, so I want to ask the doctor. My grandmom passed away from complications related to high blood pressure. And both my aunt and my mom have it now. I'm concerned about my own rate. So I'm asking, is it possible that I can also get this BP? And can you recommend any preventive measures for me?
Great, fantastic. Thank you very much, Nana Kunedo. So Nana Kunedo has taken notice of the fact that it's a family thing. Her aunts, her mom, grandma had it. And now she's thinking, I need to build a wall around myself
herself, yeah.
before anything should happen.
Yeah.
So is there's a possibility that she could have it too? High blood pressure.
Yeah, it's a possibility.
So what are the things that she should do so that she doesn't have to experience these things?
Yeah. So one of the things is taking charge of her health, being now super alert and conscious about it.
Is it a lifestyle thing?
Yes, a lifestyle thing, because I mentioned when we were treating hypertension that it's a silent killer, right? And there's a reason why whenever you walk into any health facility, the first thing they do is to check your vitals, which includes your blood pressure. Because it's not something that people routinely come complaining of. Hypertension would not routinely give you a headache, eye pain, until, of course, you're getting close to the complications of hypertension.
I see.
So you could have hypertension for 10 years without even knowing. Perhaps if you had gone to the hospital for maybe a leg pain and we check your vitals, that would be, like the red flag. That would be the first time we're diagnosing you. So it's good that she's aware of the family history. She knows that the mother had that. The auntie, I think, had that, she wants to be super alert. She wants to go to the hospital. She wants to frequently check her vitals, or perhaps get the apparatus, the digital one at home, right? And also lifestyle modifications, your diets, exercise. I mentioned that when it comes to classification of hypertension, there are stages. There's pre-hypertension, there's stage 1, stage 2, stage 3, and all that. And if you are at the pre-hypertension stage, lifestyle modification can be the mainstay.
Right.
Exercising, and I mentioned the last time that you have to exercise at least 30 minutes a day, at least 5 times a week, right? So exercise is key. Dieting, salt, the amount of salt you take should be theoretically reduced, right? So all these things come to play, and also checking to be sure that whenever you see a spike, you want to go to the facility just to be sure that you're fine.
Okay, so Nana Kunedu, there you have it. Let's do some lifestyle checks, okay? And then I'm sure that the fact that you're asking about it, you're in good place.
Yeah.
It wouldn't happen. We have Kay from Sphinx. Hi, Kay.
Hi, Della. How you doing?
I'm great. The doctor can hear you, please.
Okay, so a friend of mine wanted to know. He sent me this morning. He's in abroad, and he wanted to know. He said, I have a small PC lump on the upper part of my scrotum. I went to the hospital and was given antibiotics. It hasn't grown in size, though, but it feels uncomfortable, especially when I wear tight pants.
Okay,
so
Kay, you're going to have to read the very first part for me again. He says she has a very small what?
He said, I have a small PC lump.
Lump?
Lump.
Okay, where?
On the upper part of my scrotum.
Upper parts of his scrotum?
Exactly.
Right.
Yeah.
And it's not painful?
No.
It's not painful. Okay, great.
No.
Because you're not the direct patient, I can't ask all the, I can't do my consultation with you. But is there anything at the end of the statement that the person, the question that the person wrote that can help us with diagnosis? What's the very last part of it?
That's all. But he's watching on social media, so I think.
Great. All right, thank you so much, Kay, from Sphinx. There it is.
Yes. He said that a friend experienced a lump at the upper part of his scrotum. It could be so many things. And said he was given an antibiotic. Yeah, it could be so many things. I'm thinking that if they have a diagnosis, that's why it's important for patients to ask their healthcare providers. What do you think? What is my diagnosis? What do I have? What condition do I have? Why do I have to take this antibiotic? You always ask questions.
We should ask these.
Yes.
There you have it. We should be able to ask these things at a hospital.
Why am I taking this? You should be able to explain to you that, because I found A, B, C from what you have told me, what I have found on examination, that's what I think. You understand? Just so you go somewhere else and we ask you, do you have a history of this? And you say no. Meanwhile, you do, but you fail to ask your physician, right?
Right.
Yeah. So, so many things, spinning around my head that could cause a lump, in the the
Upper part.
groin, loin, you know,
Right.
yeah, and all that. It could be hernia. You know, a hernia could just look like a lump. You know, because certain hernias will come. There are two classes we call direct and indirect.
Okay.
Right. There's some that could come and feel like a lump. It could be a lymph node. You know, it could just be a lymph node swelling. You know, it could be that could be as a result of something else. You know, it could be, you know, anything else, a cyst formation, you know, within.
Okay.
It could be a spermatocyst. So many things can cause a lump, you know. For them to have given you an antibiotic, it means that they perhaps, it could be an abscess, right? An abscess is one of the reasons why you might
a cyst
need.
is different from an abscess.
Yes, an abscess is something, an indication why you might need an antibiotic. So they should have identified that, okay, it is this. And aside that, investigations come to confirm your diagnosis. Right. So they should do an ultrasound, you know, which is a sound wave to find out what exactly is going on. They should do some lab investigations to find out, are your markers high for which I can give you an antibiotic. So I am believing that if all those steps were, you know, done, then an antibiotic would be indicated for. Yeah.
All right. Gina is on the line from Achimota. Good morning, Gina.
Good morning.
I hope you're well.
I'm fine. How about you?
Great. I'm fantastic. Take us away. The doctor is listening.
Okay, so a couple of months ago, I was diagnosed with liver enlargement.
With what?
Liver enlargement.
Liver enlargement. Okay, great.
Yes, please. Then I came back home. I was eating very well, exercising. And then I went back, I think, a month or two. And then when I went for MRI, I don't know if I'm right, everything was back to normal. And I didn't change my eating style. I was still on the diet. And then I was having pains. I went back, and it has enlarged again. And then I have a friend who is also experiencing the same thing. She will go for checkup, and it's back to normal. The next month, it is up. And then I'm on family planning, Jadel. So I don't know if that is also causing it or there is something that is
You're on a family planning pill, sort of.
No, Jadel, 5 years implant.
Okay, great. So you're wondering if that could be the reason for the liver enlargement.
Yes, please.
Right, okay.
Because I don't take alcohol, neither do I eat fatty foods.
Okay. Right. Thank you very much, Gina. So there we have it. She's sharing almost same sentence with a friend. She went, reported at the hospital.
Yeah.
They treated it. It went away, and then it's back again. She's done an implant of the Jadel, which is family planning. Something. So she's thinking, could that be a cause of it, or something is gone wrong?
Yeah. So enlargement of the liver is what we call hepatomegaly, right? Enlargement
Hepatomegaly.
Hepatomegaly. Now, this is for you. This is not for the viewers.
Okay.
It's for you.
For me.
When I ask you the next time, you know.
Hepatomegaly. Remember.
Right. So it could be so many things that could cause that. This is one of the cases where you need a deep discussion in terms of history taking to find out, you know. So let's start from the scratch, you know, and all that. There's certain conditions that could predispose you, you know, to having an enlarged liver, right? It's not something that a discussion alone in itself would be enough.
Right.
You also have to examine to find out what is the consistency of the liver. You know, there are certain livers that you feel some nodules. Tells you about something else. When you feel it enlarged, but it's smooth, it tells you something else.
Oh.
Yeah, it's smooth, tells you something else. And livers that enlarge and reduce in size tells you something else, right? You want to find out, do you get tired often? When you sleep flat in bed, do you gasp for air? It tells me that this perhaps is coming from the heart, right? Coming from the heart. So a heart condition can cause a liver problem, right? So we want to find out. There are so many causes of, you know, enlarged liver. So many. It could be either primary from the liver or from somewhere else that is causing the liver to enlarge.
Right.
Then, after examination, you have to do investigation. She mentioned she had done an MRI. You know, we have to do an investigation. What is the result of the MRI? You know, what is it saying? And so that could help us streamline to understand that perhaps, oh, this is what is causing it, and this is the medication, or this is the management for it. There's so many causes. Even malaria. Malaria can cause your liver to be enlarged. You know that, right? Yeah. So many things. It could range from something as simple as malaria. By the way, tomorrow is World Malaria Day.
Oh, yay.
Right. As simple as
no malaria year.
Right.
Right.
It could be as simple as a malaria. It could be as extreme as a cancer. But because we don't want to miss out on anything, it's best to get proper checkup to ensure we are not missing out. It could be something very, less sinister. It could be something also very sinister as a cancer, because a blood cancer can cause enlargement of the liver.
Wow. Many things do.
Yeah.
So now, she's gone to the hospital, all of these things. Do you think she's asking something wrongly? How would she now present her case or herself? How should she describe it such that she's giving the right, because I feel like sometimes we have the thing, we're going through it, but we don't present it the way we should. And if the doctor doesn't have that much time to do all that, when you guys sit for long hours and about 1,000 people, you might feel like, okay, I don't have enough time to ask all these questions, so let's just do this. And some tend to be try and error, on the excess. So what should we ask for her when she goes back to that hospital? What should she be talking about?
Her concerns.
Right.
What is most worrying to you now is what she should be talking about. And what is most worrying to her now, from what I've gathered so far, is the fact that she experienced that her liver was enlarged and went back to normal. And it's enlarged again. That's a concern. That's all you need to table before us. And then we ask you the questions, because again, the eye sees what the mind knows, right? And it doesn't take 10,000 years to get a diagnosis. Sometimes you're not really sure, you want to investigate, right? But it doesn't take 10,000 years to have differentials, a list of things that could possibly cause.
Right.
Right. And because we're on air, it looks like I'm maybe taking my time, but if you are with the patient, these are conversations that you have real quick.
Okay.
You elicit, oh, do you have this? No. Do you have this? Yes. So it shouldn't be that, long 2 hours conversation, right? So we know the questions to ask you depending on what is most worrying to you, right? So based on that, we could, streamline even your investigation. You don't have to do everything, all the tests. Because even hepatitis A, B, C can all cause liver enlargement, So many other things can also result. So we want to ask these questions. So what she should present to the hospital is what her concerns are.
All right. So my girl, Gina, there you have it. I think that you should go back to the hospital and present your most worrying concerns. I've had this before, did the MRI, and it's back again. The pain is back again. What do you think is causing that? If you have to do checks, let's do it again. And for your friend, I think your friend should also get to the hospital and get it checked. I would recommend the bank hospital for your friend, since, from what you're saying, there's no history yet. So she can get to the bank hospital, and then we'll be sure to check that. But we know that the moment you're doing right by the medications, you will be well pretty soon. Touching on malaria before we go, tomorrow is World Malaria Day. Anything that we must know was, I know that 2 years ago you were talking about getting to zero malaria issues here in the country. So the Ghana health system was talking about they're trying to get to a point where there is no malaria at all, and that is both ways. We have what we have to do as patients, right? We need to be sure that we have a good environment. You sleep in a treated mosquito net. You're quick to go and check at the hospital, do I have malaria, and all of that. You want to keep your children closer. Some people, you need to spray, all these insecticides and all of that. It's a two-way street. And also Ghana Health Service also doing their best to actually eradicate all of this. So what's up for this year?
Yeah, so the theme for this year is Malaria Ends With Us. whether it likes it or
fantastic.
not. It ends with us.
Right.
You know,
right.
so, and then there are 3 key areas where we say we have to reignite, we have to reimagine, and we have to reinvest.
Reignite,
Reimagine, and reinvest. Right, because we have the protocols.
Yeah.
We have the systems. We have the mosquito nets. What we have to do is to reignite our passion for ending malaria. We have to reimagine even new processes, new procedures to help us.
Right.
We have to reinvest because malaria is often forgotten now because we feel like, oh, there's Coatem somewhere waiting for you. You know, so you want to get it before you go for Coatem. Why not prevent it in the first place, right? So malaria ends with us is a theme for 2025.
I see. Yeah. Malaria ends with us. Let's receive another caller. Chris, right from Okwegono. Yeah. Hello. Grace?
Grace.
Hi, Grace.
Hi.
I hope you're good.
Morning. Yes, please, Father Grace.
Okay. Oh, well, Grace is fine by His grace. Yeah. Can you speak up a little bit for me? I'll be very grateful.
Okay.
Right.
So, I am a 48-year-old lady.
Okay.
I feel pains around my waist. I don't know if it's part of menopause. I just want to ask, doctor.
Okay, so you feel...
The pain is sometimes very severe around my left side.
Okay.
And it even affects my foot. I don't know if it's all compounded. It all comes with menopausal symptoms or something.
I see.
Just want to know.
But you're 48.
Yes, please.
What do you do, please?
Come again?
What do you do? What work do you do?
Well, I am a cashier in an institution.
Right. So I'm imagining you sit a lot?
Sure, I do.
Right. Do you get time to get up, go to the canteen, exercise a little bit, and sit back down?
Yeah, I do. Right. Once in a while, when I sit for a while, I get up and walk about, and then...
I see. All right, great. So, Doc, 48, scared it might be menopause, has pain in the waist, mostly at the left side, that connects to her feet sometimes. She says that she used to be a cashier, or she actually is a cashier, and she works for long hours. In Ghana or in Africa, if you're a cashier, you're sitting for long hours, unless, of course, there's nobody in your institution. Yeah, so she says that she gets up sometimes to, walk about and everything.
Yeah.
She's thinking it could be a menopausal, something, but...
Yeah.
At your table.
Yeah, so I think that maybe we might not have enough time today because we're running out of time to actually delve deeper into, her case. But if you could go back to our video on back pain, lower back pain, she will have the full stuff that she needs, to answer her questions. Like I mentioned, there are so many causes. I think I even highlighted the pain that would be in one side, your buttocks radiating, moving down to your legs. I mentioned those kinds of pain, and I mentioned the times, other things you should look out for as red flags. Are you able to control your bowel? Are you able to control your urine? And all that. Back pain that's chronic and acute, if you remember.
Yes.
Right. And then the one that is degenerative in a sense where it comes with age. So maybe there's weakening of the bones or the disc within, the bones. Or there's a slip disc, which in this case would be asking the occupation, does she lift heavy object or not? We also spoke about, that's related to occupation you do when it comes to sitting, ergonomics, sitting for a long time without getting up, your posture can also result in back. So there are 1,001 reasons why she could have a back pain. So if she could quickly just track back to that video, I'm sure she would have.
That would be great.
Yeah.
But you don't think it has anything to do with menopause? 48?
Yeah, so that's why I mentioned that it could be degenerative. When we say degenerative, it means that something that comes with age. Yeah, so as a result of wear and tear of the bones,
But is the 40 range a range for menopause?
Yeah, so it's depends on the individual.
Oh.
Yeah, just like how some girls can have puberty as early as 9 years.
Okay, great.
And some as late as 15. The same way some other people can reach menopause as early as 40 and as late as 55.
Oh,
right.
great,
So
great.
yeah, it depends on the individual.
Alrighty. So I think the producer would get to you on that and then give you a link as to that discussion so that you can fully grasp what could be wrong. Then when you get to the hospital, you know what to say, how to describe the pain and all of that. So malaria ends with us.
Yes.
Ends with
Reinvest,
us.
reignite, and reinvest. Yes.
okay, so
Reinvest, reimagine.
Okay, reimagine.
Yeah,
Right.
yeah.
Alrighty. So this is where we draw the curtains for today's health session. Thank you to the Bank Hospital for supporting the morning show. And we enjoyed your time with us. Thank you for choosing as always. But you know what to do. Anytime you feel like, okay, you have a question, why not drop it on our socials? So be sure to share it. But anything that you're going through, if you have the chance, go to the Bank Hospital, get your health checked out. And that's how we want you to be healthy. Thank you very much, Doc.
Thank you.
Let's go for a break. We'll be back.
I decree today that the power of God that is coming upon your life, no enemy will touch you and go free.
Experience the power. Take dominion.
Say in the name of Jesus. I prophesy. Doors of